Hello and welcome. Today we're going to discuss a condition called rectocele, a common pelvic floor disorder that affects many women. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you can do to prevent it. So let's dive in. So, what exactly causes a rectocele? Well, it's essentially a weakening of the tissue between the rectum and the vagina. This weakening allows the rectum to bulge or herniate into the vagina. Multiple factors can contribute to this. Childbirth, especially multiple vaginal deliveries or difficult deliveries, is a major culprit. The stretching and strain on the pelvic floor muscles during labor can weaken the support structures. Other factors include chronic constipation and straining during bowel movements, chronic coughing, heavy lifting, obesity, and simply the natural aging process, which can lead to tissue weakening and loss of elasticity. Some women may also have a genetic predisposition to weaker pelvic floor tissues. Now, let's look at the pathophysiology, or how this condition develops. The pelvic floor muscles and connective tissues, including the rectovaginal septum, normally provide support for the pelvic organs. When these structures weaken or tear, usually from the factors we just discussed, the rectum loses its posterior support. This lack of support allows the rectum to push against the vaginal wall, creating a bulge or pouch. Over time, this bulge can enlarge, causing symptoms. The size of the rectocele and the degree of symptoms often correlate, though some women with larger rectoceles may experience minimal symptoms, while others with smaller ones may have significant discomfort. Rectocele is a relatively common condition, particularly in women who have had children. Its exact prevalence is difficult to determine, because many women may be asymptomatic or too embarrassed to seek medical attention. Studies suggest that a significant percentage of women have some degree of rectocele, but not all experience symptoms that require treatment. The risk of developing a rectocele increases with age, parity in number of pregnancies, and history of pelvic floor dysfunction. It's important to remember that while it is common, it doesn't mean it's something you just have to live with. Effective treatments are available. Okay, let's talk about the signs and symptoms. Many women with small rectoceles may not have any symptoms at all. However, as the rectocele grows, symptoms can develop. Common symptoms include a feeling of pressure or fullness in the vagina, a bulge that can be felt in the vagina, difficulty emptying the bowel completely, needing to press on the vagina or perineum, the area between the vagina and anus to have a bowel movement, constipation, fecal incontinence, leakage of stool, and painful intercourse. Some women may also experience lower back pain or pelvic pain. The severity of symptoms can vary greatly from person to person. So, how is a rectocele diagnosed? A healthcare provider will typically start with a thorough medical history and physical examination. During the examination, the doctor may ask you to strain as if you were having a bowel movement. This helps them visualize the rectocele and assess its size. A pelvic exam will be performed to assess the support of the pelvic organs. In some cases, additional tests may be ordered. A defecography, which is an X-ray taken during defecation, can help visualize the rectocele and assess how well the rectum is emptying. A colonoscopy may be performed to rule out other conditions, such as colon cancer. And an erectile manometry test can measure the function of the anal sphincter muscles. Rectoceles are often classified based on their size or the extent to which the rectum bulges into the vagina. This classification helps guide treatment decisions. A common classification system divides rectoceles into 3 grades. Grade 1, where the rectocele is small and doesn't extend beyond the lower third of the vagina. Grade 2, where the rectocele extends to the mid-vagina. And Grade 3, where the rectocele extends to the vaginal opening or beyond. However, it's important to note that the grade doesn't always correlate with the severity of symptoms. Treatment is typically based on the symptoms, rather than solely on the size of the rectocele. Now, let's discuss treatment options. Treatment for rectocele depends on the severity of symptoms. For mild cases with minimal symptoms, conservative management is often recommended. This includes lifestyle modifications such as increasing fiber intake, drinking plenty of fluids, and using stool softeners to prevent constipation. Pelvic floor exercises, also known as Kegel exercises, can help strengthen the pelvic floor muscles and improve support. A pessary, a removable device inserted into the vagina, can provide support and reduce the bulge. For more severe cases where conservative measures are ineffective, surgery may be considered. Surgical options include repairing the rectocele through the vagina or through the abdomen. The goal of surgery is to restore the normal anatomy and improve bowel function. Can rectocele be prevented? While it's not always possible to prevent a rectocele, there are steps you can take to reduce your risk. Regular pelvic floor exercises, especially after childbirth, can help strengthen the pelvic floor muscles. Maintaining a healthy weight can reduce strain on the pelvic floor. Avoid chronic constipation by eating a high-fiber diet, drinking plenty of fluids, and using stool softeners if needed. Avoid straining during bowel movements and lifting heavy objects correctly. If you have a chronic cough, seek treatment to reduce coughing. Finally, let's talk about the prognosis and any recent advances in treating rectocele. The prognosis for rectocele is generally good, especially with appropriate treatment. Conservative management can often provide relief for mild cases. Surgery is usually effective in correcting the anatomical defect and improving symptoms for more severe cases. As for recent advances, research is ongoing to improve surgical techniques and materials used in rectocele repair. Some studies are exploring the use of mesh to reinforce the repair, but the use of mesh is controversial due to potential complications, so it's crucial to discuss the risks and benefits with your surgeon. Continued research is aimed at developing less invasive and more effective treatments for rectocele.